Hello, my name is Nilanjan Ghosh. I'm an assistant professor at the Sidney Kimmel Comprehensive Cancer Center at the Johns Hopkins University in Baltimore, Maryland. I'm here at the ASH meeting in New Orleans presenting the results of the study titled Addition of clarithromycin to lenalidomide and dexamethasone is effective in multiple myeloma after progression on lenalidomide and dexamethasone. The background for the study comes from the initial studies in newly diagnosed multiple myeloma with the BIRD regimen, initially reported by Dr. Niedzwiecki and his colleagues from Cornell. In those studies, BIRD showed an overall response rate of over 90% in newly diagnosed multiple myeloma and a progression-free survival of about 3.5 years. Subsequently, case control comparison between BIRD and Revlimid and dexamethasone showed superiority of BIRD in terms of overall response rate and progression-free survival. The exact mechanism for clarithromycin in multiple myeloma is not well understood. However, we know that clarithromycin can potentiate the effect of corticosteroids by inhibiting hepatic metabolism, and it's also known that clarithromycin can inhibit levels of IL-6 and increase interferon gamma and IL-10, and one can hypothesize that these may synergize with the immunomodulatory effects of lenalidomide. However, conclusive studies for this have not yet been performed. We analyzed 24 patients with multiple myeloma at our center who had disease refractory to lenalidomide and dexamethasone. At the time of progression on lenalidomide and dexamethasone, clarithromycin was added to this regimen without escalating the doses of lenalidomide and dexamethasone. The median age was 61, range 41 to 80 years. The median number of prior therapy were 3. Patients who had previous stem cell transplant were included in the cohort. High-risk myeloma was defined by FISH and cytogenetics. Patients who had either a 13q deletion on conventional cytogenetics or presence of deletion 17p, 1q21, or translocation 414 or 1420 or 1416 on either FISH or cytogenetics were considered as high risk. About 48% of the patients in this cohort had high-risk multiple myeloma. 10 patients had a partial response or better, which gives us an overall response rate of 42%. There was 1 complete response and 1 very good partial response. The clinical benefit rate was 46%, which includes patients who achieved a minor response. The responses were durable. The median duration of response was over 7 months. The patients who had a disease which was previously responsive to lenalidomide and dexamethasone trended to have a higher response with BIRD. However, even in patients who had never responded to lenalidomide and dexamethasone, we saw responses with BIRD, including complete response in 1 patient. Patients with high-risk genetics had the same response rate as patients with standard risk features. The median progression-free survival was 4 months. Increasing prior therapy adversely affected progression-free survival. High-risk features on cytogenetics or FISH had no impact on progression-free survival. The median overall survival was 25 months with a median follow-up of 28 months. High-risk myeloma was the strongest predictor of poor overall survival. Increasing prior therapies also adversely affected overall survival. The regimen was quite well tolerated, and 2 patients needed discontinuation of the regimen because of toxicity. 1 patient had GI toxicity and a second patient had anemia and fatigue. Grade 3 transaminitis was seen in 1 patient, and this resolved without any alteration in doses of the clarithromycin. So our retrospective study demonstrates that addition of clarithromycin was able to overcome resistance to lenalidomide and dexamethasone in a subset of patients. Responses were durable and the regimen was well tolerated. This is an exciting opportunity for patients with multiple myeloma, as the study shows that you can salvage response to existing therapies and provide effective, durable, and safe and well tolerated treatments for patients with multiple myeloma. However, these retrospective results should be verified in a prospective manner.